Medicare Advantage versus Medigap, the honest comparison 2026. If you are on Medicare or getting ready to enroll, there is one question that comes up more than almost any other. Should I get a Medicare Advantage plan or a Medicare supplement plan? And the honest answer is, it depends. It depends on your health, your income, your doctors, your medications, and how you want to manage your healthcare costs. What I can tell you is that there is no universally right answer. Both options have real advantages and real drawbacks. And anyone who tells you one is always better than the other without knowing your specific situation is not giving you the full picture. My name is John. I am a licensed Medicare insurance agent. Today, I am going to break down both options clearly and honestly so that by the end of this video, you will have the information you need to make the right decision for your own situation. Before we compare the two, let's make sure we are on the same page about how Medicare works at its foundation. Original Medicare consists of Part A, which covers hospital stays, and Part B, which covers medical services and outpatient care. Together, they cover a significant portion of your healthcare costs, but not everything. Original Medicare has deductibles, copays, and coinsurance. And critically, it has no out-of-pocket maximum. That means in a serious illness scenario, your costs could theoretically keep climbing with no cap. That gap is exactly what both Medicare Advantage and Medicare Supplement are designed to address. They just do it in very different ways. Think of it this way. Original Medicare is the foundation. Medicare Advantage and Medicare Supplement are two completely different types of roofs you can put on top of that foundation. Same foundation, very different structures. Let's start with Medicare Advantage, also known as Part C. Medicare Advantage plans are offered by private insurance companies approved by Medicare. When you enroll in a Medicare Advantage plan, you are essentially replacing original Medicare with an all-in-one alternative. The private plan takes over your Part A and Part B coverage, and most plans also include prescription drug coverage, Part D, built right in. The biggest draw for most people is the cost. Many Medicare Advantage plans have $0 monthly premiums. You still pay your Part B premium to Medicare, which in 2026 is $202 with 90 cents per month for most people. But your Advantage plan itself may cost you nothing additional. Beyond cost, Medicare Advantage plans often come with extra benefits that original Medicare does not cover: dental, vision, hearing, gym memberships, over-the-counter allowances, and transportation to medical appointments. So what is the trade-off? Medicare Advantage plans work within a network. That means your doctors and hospitals need to be in the plan's network for you to get the lowest costs. If you see an out-of-network provider, you may pay significantly more, or in an HMO plan, nothing may be covered at all outside the network. Medicare Advantage plans also have their own cost structure, copays, deductibles, and an out-of-pocket maximum. In 2026, the average maximum out-of-pocket limit for Medicare Advantage plans can be up to $9,350 for in-network services. That means in a serious medical event, you could owe up to that amount before the plan covers 100%. Medicare Advantage is generally a strong option for people who are relatively healthy, who have lower fixed incomes and want to minimize monthly premiums, whose doctors are in network, and who are comfortable working within a managed care structure. Let's talk about Medicare Supplement, also called Medigap. Medicare Supplement plans work alongside original Medicare rather than replacing it. You keep original Medicare, and your supplement plan pays some or all of the costs that Medicare does not cover: the deductibles, the copays, and the coinsurance. One of the most popular Medigap plan in 2026 is Plan G. With Plan G, after you pay the Part B deductible, which is $257 in 2026, your supplement plan covers virtually everything else Medicare approves. No copays, no co-insurance, predictable costs. That predictability is the biggest advantage of a Medicare supplement plan. You know almost exactly what your health care is going to cost you each year. For someone managing a serious or chronic condition, that level of financial certainty is enormously valuable. The other major advantage is freedom. Medicare supplement plans are accepted by any doctor or hospital in the country that accepts Medicare, and that is over 1 million providers. There are no networks. There are no referrals required. You can see any specialist anywhere without asking permission. So, what is the trade-off? The monthly premium. Medicare supplement plans cost significantly more per month than most Medicare Advantage plans. Plan G premiums vary considerably depending on your age, your location, your gender, and whether you use tobacco, but you are typically looking at anywhere from $80 to well over $200 per month depending on those factors. And Medicare supplement plans do not include prescription drug coverage. You would need to add a standalone Part D plan for your medications. Medicare supplement is generally a strong option for people who have more complex healthcare needs, who travel frequently and want nationwide coverage, who value predictable costs over lower premiums, and who want the freedom to see any provider without network restrictions. Let me put this side by side so you can see the key differences clearly. On monthly costs, Medicare Advantage often has zero or very low premiums. Medicare Supplement has higher monthly premiums but more predictable total costs. On provider access, Medicare Advantage requires in-network providers in most plans. Medicare Supplement works with any Medicare accepting provider nationwide. On out-of-pocket risk, Medicare Advantage has a defined out-of-pocket maximum that could be reached if you have serious medical year. Medicare Supplement limits your out-of-pocket to essentially just the Part B deductible. On extra benefits, Medicare Advantage often includes dental, vision, hearing, and more. Medicare Supplement does not. On prescription drugs, Medicare Advantage usually includes drug coverage. Medicare Supplement requires a separate Part D plan. Neither option is objectively better than the other. The right choice depends entirely on your individual health situation, your financial situation, your providers, and your priorities. Someone on a fixed income who is generally healthy and has their preferred doctors in network may find Medicare Advantage to be the smarter financial decision. Someone with significant health conditions who values predictability and provider freedom may find Medicare Supplement worth every dollar of the higher premium. Here's my honest advice after working with Medicare beneficiaries day in and day out. Do not make this decision based on what your neighbor has. Do not make it based on a commercial you saw on television. And do not make it based on the premium alone. Make it based on your doctors, your medications, your health history, your financial situation, and your priorities. I hope this video provided help with thinking through which option makes the most sense for your specific situation. And that help costs you absolutely nothing. As a licensed Medicare agent, my help is always free. Drop your questions in the comments below or reach out to me directly. New Medicare content every single week in plain English. I will see you in the next one.